One in every 160 children are affected by autism globally. Often a child is at least 2 before the disorder can be diagnosed. But a new study has found a simple sniff test may help detect autism much sooner. Michelle Dickinson joins me now. Michelle, good morning.
Good morning.
Have you won any awards since I last saw you?
No, Paul.
It's like almost weekly you win some amazing award. The funny thing about this test and others, when we talk, is who thinks in the first place that this might be a possible test for autism, for instance, how someone smells a smell.
Right. So autism is a neurodevelopmental disorder, and so they started looking at some of the things that would be controlled by that are involuntary. So sniffing, for example, is one of those things. So it made sense to at least test this.
Okay. So sniffing is involuntary, and then of course there is the judgment call. I like how this smells. I don't like how it smells. So how does this test work?
So basically, if you are given an unpleasant smell, you usually stop smelling it. And so it's a really simple test, but it can be done with very young children. And the problem with tests when you say, do you like or not like the smell, is you desire verbal communication, so you ask the child or the person. And a lot of children on the autism spectrum actually don't have very good communication systems, so they aren't able to respond yes or no. So this was a test in which they placed a little tube on the nose, and it detected how the child breathed in and out, so how much sniff response it was, and how it adjusted based on certain smells. And then
so how do you know how it... So for instance, you smell something you like, you're going to smell it in one particular way. Something you don't like, you'll smell it another way.
So something you smell that you like, so they did roses and shampoo, for example, you might smell and inhale it deeper. The horrible ones were like rotten fish, not great. So you would stop smelling and you would stop the sniff.
So how do they measure that? How do they see?
So they just have little flow sensors, and they had this tube that was placed close to the nose. And the children who weren't on the autism spectrum disorder, within 305 milliseconds, stopped smelling the unpleasant smell. The children who did have autism didn't alter their sniff at all. And so it was unconscious, and the children were just watching a cartoon at a time. So it was 10 minutes of cartoon time, 10 different smells over a 1 or 2 second blast, and just measuring how the pressure flow changed in the nasal cavities. And it was very easy to detect the children who weren't on the disorder because they changed their sniff unconsciously. They were just watching cartoons. And the children who did have autism actually just continued smelling without any change.
Now, it's one thing to be on the autistic scale, and a lot of children are on the autistic scale. The question is, where on the scale are you? Does this test show you not only whether someone's there, but how far along?
Yeah, so now this was a very small study, only 36 children, of which 50% had been diagnosed with autism. They ranged from 4 to 11 years old, but they did actually find that those children who sniffed in more of the unpleasant smell were actually higher on the spectrum. Yeah, so still a preliminary study, but very interesting and very good to be done with children who are much younger than those who can maybe have communication
Because
skills.
the sooner you can diagnose it, the sooner that you can try and adjust it.
Neuroplasticity in our brains is great. So actually, the younger you find autism and you give them positive treatment and therapies, you can actually really reduce the severity of the symptoms.
One of the great things about some of these things that you've been talking about recently is that they're very cheap and very easy to administer these sort of tests.
Yeah, and not stressful. So there is no blood test for autism, and so there's no blood work. This is kids watching a cartoon for 10 minutes, something attached to their face. It said the children didn't seem to mind that this was just strapped to
So what
their
happens
face.
with a test like this now? As you say, it's in its early stages.
Yeah. So they're going to do a much bigger study now, and especially in children that are younger. It would be great if we could diagnose autism within, before the age of 1, so that developmental training can be done very early. So now this study has said that they're going to try and do a bigger set of children and those who are much younger.
Is there a worry with things that are just so simple like this that you will get parents doing these sort of things at home and then all of a sudden becoming alarmed because they can't conduct the test correctly?
Do you know, I don't think there's any harm in trying to test, because what you would do
Isn't
then
it like the medical journal, you flip through, look through.
But to then get therapy, you have to go to your doctor. So at some point, even that just makes you go to your doctor to get professional advice. I don't think that's a problem.
No, so the checks and balances are in place.
Yeah, and if you want to make your own pressure sensor at home, that's cool. Well done on you, right?
Yeah. Oh, and you need to show us how to do it. We'll pop it on the website. Michelle, thank you very much. Lovely to see you again. Michelle Dickinson, a nanotech scientist.